Hi, good morning. My name is Clark Wilon, and I'll be demonstrating to you how to administer vaccines via intramuscular, intradermal, and subcutaneous routes. So these are the materials that are going to be used. We have the syringe, the band-aid, the gloves, and the alcohol swab. So first we have the syringe. We then remove the cap, and then we extract the medication from the bottle. We make sure we place back the cap so as to not have any other injuries. We make sure that we switch needles before we administer the vaccine into the patient. So this is the alcohol swab. We apply it to the patient or on the patient in a circular motion before we administer the vaccine. So we have the intramuscular first. We make sure that we approximate a 90-degree angle before we administer. And then we now have the subcutaneous route, where we have to approximate 45 degrees before we insert into the patient the vaccination. And then next we have the intradermal route, wherein we have to approximate 5 to 15 degree angle before we insert the needle into the patient. So now we move on to the oral administration and ORS. So we just have a quick list of signs where we have to notice if there's dry mouth, pale skin, or any other signs of dehydration from the patient. So we extract the fluid using an oral syringe and measured. And then these are the recommended amount of fluid based on your child's weight. So first we have 22 pounds and below, we give 10 ml. For 23 pounds to 44 pounds, we give 20 ml. And more than 44 pounds, we give 35 ml. And then we set a timer of 5 minutes in between the intervals for administration. And then if the child refuses the oral or via the cup, we can give or use an oral syringe. If the children may get sick, we reduce the fluid by half and continue for 15 minutes. If the child continues to vomit or may vomit in any time of the medication, we can repeat the oral rehydration after 30 minutes. We also recommend to not feed the baby so as to not induce vomiting. Now we move on to the intranasal medications. Why do we use intranasal medications? Because it is very easy and convenient, and that the delivery allows very rapid absorption across the blood-brain barrier, and the onset is as fast as 5 minutes. Samples will be fentanyl and midazolam. So a pulse oximeter may be considered in monitoring the patients. And drawing medications from a glass ampule requires a filter needle, and the use of atomizer requires an additional 1.1 milliliter. But we do not recommend the use of saline, and we have to always remember to drop the correct dose of medication in the atomizer before double checking. So some of the other tips also, there should be 1 milliliter of medication per nair, and that if it exceeds 2 milliliters, the administration may remain 5 minutes after the first one. And if we are to use two medications, it can be delivered simultaneously for as long as it will not be exceeding the dose per nostril. You should also remember that the child's head should be tilted so as to avoid the dripping of the medication from the nostrils. And if the child has runny nose, try and blow the nose prior to the administration. So again, here are the materials to be used. You have the syringe, the nasal atomizer, and the medication. So again, if being drawn from a glass ampule, we may need a filter needle, and some of the correct doses per medication are indicated on the left as for fentanyl and verse intranasal. And that, again, always remember that there is a strict 1 milliliter limit per nair, and if indeed it exceeds 2 milliliters, we have to wait for 30 minutes before the completion of the medication administration. After double checking all, label all medications and prepare the equipment. 1 atomizer per medication must be used, and that we open the atomizer and secure it at the top of the syringe. Again, for priming, we would be needing an additional of 0.1 milliliters, and again, saline may not be recommended for priming. So we make sure again that the head of the bed or the head of the baby as it is at a 45-degree angle. The atomizer is then loosely placed into the nostril and then aimed at the center of the nose and quickly delivered into the nose. Since some of the medications may seem bitter or bitter tasting, the parents or the guardians may give sweet juices so as to not taste the bitterness of the medications. So again, the onset is as fast as 1 to 2 minutes, and that the usual duration would be 15 to 30 minutes, and we may need the use of pulse oximetry for monitoring. And then we move on to nebulization. Face mask or mouthpiece may be used for nebulization. The medication is vaporized to be breathed in by the patient, wherein it works similar as an inhaler, although a mask may be used for children under the age of 7, and that a nebulizer is used only if the doctor recommends it. So it's aerosol, and then when the medicine is breathed in as an aerosol, it is easily deposited deep into the lungs. We make sure that the machine is turned off before fixing any part of the nebulizer. We connect one end of the tubing to the air outlet of the compressor and the other end into the bottom of the machine. Before we unscrew the medicine cap and filling it with the right amount of medication again, the machine needs to be turned off. So this is where we prepare the medication, make sure it's the correct type of medication, and we apply it or put it inside the cap properly. So we allow the patient now to slowly breathe in the medication from the nebulizer or the machine. Slow breaths are recommended so that the inhalation will be proper and will be ingested by the patient properly. We tap onto the sides of the cap to be able to avoid the accumulation of the medication to the sides, and so that the medication will be inhaled completely. So it is 7 to 10 minutes, and mixed medications may be done depending on the prescription of the doctor. So we have to remove the tubing parts from the machine and disassemble the nebulizer parts to be able to clean the machine completely. We wipe down the outside housing of the compressor with a damp sponge. And we sterilize all the parts except the tubing and the tuber adapting by boiling. We rinse all the parts with warm water and allow them to air dry.